We're going to introduce our next guest speaker, Dr. Michel Rondinelli. Mike graduated now, it's been 8 years. Mike's on, for those of you, a lot of you know Mike in the room over here. Mike's on practice number 10 and quickly getting to 20 pretty soon. Mike did 3 startups in the last 12 months in 2019. He not so long ago got married to Vanessa. Brooklyn was born in 2019. He's been a busy boy. He travels between Sarnia, Detroit, comes back to London. He'll do dinners. He'll go to Toronto, fly down into the States. It's unbelievable. When you talk about time management, this guy's got the PhD on how to do it and balancing everything that matters and is important in his life, in spite of everything he consistently puts on his plate every 24 hours. We asked Mike to kind of share, when you're doing 3 startups simultaneously, you better have a system. And Mike was kind enough to share this with us at a previous event, that he's very systematic about his checklist and how to do it and what to do and completely create flow. So in the next 30 minutes, you're going to get a treat and a taste for Dr. Michel Rondinelli and the magic of doing a practice startup, disruptive style.
Check, check. Everyone hear me good? Everyone hear me at the back? Thank you. So thanks for having me. What a great lineup of speakers today. So much disruption happening that I think the college is going to shut this down next year. So anyways, yeah, so thanks to everyone that's already spoken. You guys are all wonderful. Vic, I know you've gotten a lot of praise, but I've known you the last 10 years. You've helped me out, you've helped my wife out, we really appreciate it, and you've really outdone yourself this year. This is phenomenal. And the whole Jindal financial team, you guys are absolutely amazing. So I'm going to summarize how to do a startup. Usually it takes a few years to plan and execute everything, but I'm going to summarize it into 20 to 30 minutes here, so let's see how that goes. So just about me, I'll talk about myself for just a couple minutes here. So I graduated in 2012 from UDM. We have the Huron Dental Group, so that owns the 12 locations that we have right now. There's a Huron Dental Management company, so we have a side company that helps to run all the practices. They provide services such as centralized AR, ordering in a group setting. We have in-house bookkeepers, we have a CFO, we have a full-time marketing staff, so we provide group services for the 12 locations. Why I became a dentist, so that jacked up pan that you're seeing there is my teeth actually a few years ago. So I was congenitally missing my 4 lower incisors, my 4 premolars, and 2 upper molars. So if anybody knows of anybody that's missing more teeth than that when they were born, I want to meet them. So anyways, I was always at the dentist from a young age. Seemed like it was pretty good, but I really struggled academically. I wasn't the smartest guy out there, and actually applied to dental school for 3 years straight and never got in. So, and then when I did get in, UDM finally said yes. I probably graduated at the bottom of my class academically. So the reason why I'm telling you this is not to walk out of the room or anything, but to say to all the dental students out there, you don't have to be the top of your class to do well in life. Don't worry about academics. Just focus on a lot of the things that you guys learned today, and you'll be just fine. So, just to give you like a quick 30 seconds, everyone asks how'd you buy your first practice? How'd you get started? So 2012, I started working in Sarnia. I was born and raised there. Dr. Shergan and myself teamed up and bought the Grand Bend location back in 2013. We had no clue what we were doing. We were trying to lay floors. We were trying to run an office staff that didn't even exist. So we learned so much along the process. 2014, Dr. Shergan found a great location in North London. You guys probably know it, Stony Creek Family Dental. So we built that. That was our first startup practice together. We almost killed each other trying to build it because we knew nothing and we were trying to self-contract it. So learned so much from that project and learned so much from Dr. Shergan. 2015, we added a location in Windsor together. 2016, I added a location in Corunna. 2017, we bought a practice in the Kettle Point Native Reserve, one in Forest, and one in Windsor. And then 2018, we added one in Brights Grove. And then 2019, one's in Windsor, Leamington, and Chatham. In 2020, we have Windsor, Strathroy, and Kingsville that will be opening within a few months here. So here's some of the brands that we're associated with. So you can see similar colors, similar branding, all for marketing purposes. A cool, exciting project that I'm working on right now is called Bespoke Consulting with Elizabeth, who's in the crowd. She's going to be, and myself, we're going to be working on this company. So we're really going to be helping dentists put into effect a lot of the things that we talk about. So consulting, marketing, management, but with our team and our resources, we're going to hopefully absolutely implement things actually instead of just telling people about it. So we're really excited about that opportunity. So, and shout out to my wife, married her in 2018, she's here today, and then our new little baby girl, Brooklyn, a little picture of the Brooklyn Bridge because we started dating when Vanessa was living in Brooklyn. So she's 3 months old today, and she's the absolute best thing to ever happen to us. So now I'll get into the meat and potatoes here of why I'm here. So how to build your dream startup practice. And I really mean dream when I say that because you get to literally see something that you like, you know, you see a picture on Instagram, you see something on Pinterest, and you put that into reality. For me, there's been nothing more satisfying than seeing something that I want to build and then get to walk into it the next day. It's been the best part of my job. I love seeing patients. I absolutely love interacting with my team, but seeing a project that I put together and that I implemented from the ground up has been the best part by far. So again, Stony Creek, Windsor, Corunna, Forest, Clearwater, which this is going to be a focus of the presentation in a second, Brights Grove, and Chatham, Leamington, and Strathroy are all startup locations that I've done over the past 6 years. So instead of just giving you like a laundry list of what to do when you're doing a startup practice, I thought it would be cooler to kind of just walk you through our thought process and my thought process when we build an actual startup location. So I took this beautiful practice that we built in Sarnia. It was my second location in Sarnia, called Clearwater Family Dental. So we're going to take the next 10 minutes just to kind of slowly walk you through the process that we followed here. So before we start any project, you have to have a reason why you're going to do that. So this young gentleman here, Dr. Gabriel Ponce, some of you probably know him. He graduated from UDM in, I think, 2014. So Gabe was working for me at my other Sarnia location and my Grand Bend location, and he wanted his own practice. He didn't want to keep working for me. So we ended up offering some equity stake in the other practices, but he didn't want that for a few reasons. He wanted a project of his own. So we built this project just for him. All right, so now just to walk, this is going to be what we're going to talk about today. So we're going to go through location analysis, construction, leaseholds, dental equipment, electronic and finishes, clinical decisions, practice development, operating efficiencies, human resources, management and leadership, and practice metrics. So we're going to cover that all in the next 10 minutes, so hold on tight, everybody. So this is Clearwater Family Dental here. This is a map of Sarnia. Anyways, this is the location that we picked for Dr. Ponce. Now, location for me is the number one thing when building a startup practice and the most important thing to determine success in the long term. So getting the location right, and Dr. Jake Carrier already talked about this, so I'll blow through it pretty quickly, but this is very, very important. So we look for some new developments. These are the 3 areas that the city's growing, okay? So we picked Clearwater because it was strategically positioned between these. We looked for existing dentists. So again, we're kind of situated in the south end of the city, so that was allowing us to stay away from some of the other dentists in town. You look for traffic counts. Having great traffic counts and then putting a big sign is the best form of advertising you could possibly do. So we're at 17,000 cars a day. The 2 busier streets in town are at 20,000 and 19,000, so it wasn't the number 1 spot, but we're pretty close. Then you got to look for commercial availability once you've narrowed it down to an area where you want to be. So you're looking to buy a property or you're looking to lease a property. Both have pros and cons to it, so that's best left to sit down with your advisors to discuss and your accountants. But anyways, we decided to find a lease location, and there's a lot of factors that have to go into your lease. So you need to look for base rent costs. You need to look for any tenant allowances. You need to look for, can you transfer that lease someday? So once you find a spot, there's still a lot of things that you need to tackle. You know, don't just jump into a location. not one of the main things that we look for, but Lambton College was going through a major expansion, so that was one thing that drew us to that location. And then demographics and population density. I hear so many times from dentists like, oh, I put a startup location here because there's like 1,000 new $1 million homes going up. When we're looking at demographics, we don't want the place where there's $1 million home going up. Because what happens is, there's usually a very proliferative family, and socioeconomically, typically those people don't need any cleaning. All they need done is cleanings, and they have perfect teeth, and they don't have any insurance plans. We look for areas where blue collar, they work at a factory, they have a lot of dental needs and dental requirements. So the south end of the city worked very well for us there. And population density, this was actually the densest population in the whole entire city was that corner. So it was an easy choice. Now we're going to go through really quickly the construction and leaseholds, and I'm not going to bore anybody with it, but the first step is you got to design the clinic. So sit down with one of the companies, dental companies, and they'll design your clinic for you. And this is super cool because you get to just draw up whatever you want and then make it a reality. So customize it for sure. And I'm going to show you what we did to customize in a second. Anyways, and then once you've got it designed, you bring it to an engineer, and they'll get ready for the permit stage. You finalize any loose ends on the leases. Find a contractor and stick to a timeline and a budget with them, and then apply for your radiation right away, your HARP approvals, because sometimes you can't even put a shovel in the ground until you have your HARP approvals. So what did we do to customize this practice? This is Clearwater Family Dental, like I said. So we wanted like big glass windows in the front so that natural sunlight would come in. We did that. We put iPads on the walls. That was something for the kids. We had a separate reception checkout counter. So when someone's just got a bill for $1,500 or $2,000 or Mrs. Jones, here's your dentures that were put in, the whole waiting room's not going to hear that Mrs. Jones has dentures. So we put a separate checkout counter as people are walking out. Sterilization, notice how it's right in dead smack in the middle. So that's for flow and efficiency. So every single one of the operatories around there can hit that sterilization center really, really quickly. We put a consultation room and a private office right behind the reception desk so that the doctor is actively engaged and the staff isn't looking around for the doctor. Another thing, the consultation room is all wired and plumbed to add a fifth operatory down the line once it gets busy. Utility room back in the corner, so you're not going to hear the compressors and vacuums at all times, and it's all insulated with soundproof drywall. And then a barrier-free washroom. It's not the most, you don't want to have a bathroom that big, but you have to. So you have to follow all your permit codes. And then notice the operatories. The chairs are all situated, and you'll see a picture later. The chairs are all situated so that you can actively walk into the room and be face-to-face with that patient. So just what Melissa was talking about communication and being face-to-face with that patient. You don't want to walk in behind them. You don't want to walk in from the side of them. You want to hit them dead smack in the middle. So that's how we designed that. And then the chair is right there so you can get right to work. You're not having to cross over to the other side. You're not having to fiddle around with the delivery systems. You're right there and ready to go and ready to work. Save time. So this was the location before when we just got our hands on it. This is what it looked like on the inside. So this is called the vanilla box. It's just basically an empty room. This is when we started trenching all the floors, cutting, so all your electrical and plumbing is going to be going through there. And these are the steel studs that get put up for the walls. And then the lead requirements. So build with someone that knows how to do a dental office because the lead requirements are always changing, so you need to make sure you're following them. I will warn you, there's one scary side of construction, and that's when Dr. Shergan finds a Kubota tractor. Be careful, but any good business partner would jump right in there. So after you've built the whole thing, you need to obviously put some dental equipment in there. These were the two companies that were involved at Clearwater Family Dental. We've had a great relationship with them, and they've been absolutely phenomenal, helping us with everything that we've ever needed. Sometimes you get the perks of even going to tour the facilities, and this was our trip to Midmark, where we got to design some of it and check out the chairs and all that kind of stuff. So really cool experience. So yeah, once you have an actual operatory, there's a couple things that you need to consider and you need to think about. So where do you want the delivery system to be? Is it going to be right on the chair so that you can grab things efficiently? Do you want it behind you? Do you want it on the side? That all depends because you need to put your plumbing and your electrical in all these places. So think of how you want to deliver care to that patient first. When you're talking about a pan machine, are you going to upgrade to a CBCT someday? That needs to be considered because you're going to have to double lead line the rules now according to the new guidelines. Are you going to have a prime scan, CIRAC? You know, Jeff Sumner can talk about that. Absolutely great way to deliver care to your patients. In the future, patients aren't going to stand for having crowns done in any less than an hour. So we centered this room in this office right around our milling machine. So patients are constantly asking, what is that? And we tell them. And it looks to them that we're the latest and greatest when it comes to dentistry. And obviously sterilization, everyone's heard about this. The RCDSO and the public health guidelines are absolute crazy. So you need to design it all with those most recent guidelines in accordance. So a clear transition from back to front with the sterilization. We got the blue light that's clean, the red light that's dirty. We actually developed this cool system where every single instrument has a barcode, and we have a scanner, and we can scan everything that gets put into that iPad that you see, and that we can detect where every single instrument is at every single time. Electronics and finishes. So what we did in this clinic was Dr. Ponce is a very big cosmetic dentist. So you can see from the lower left, he has a full-out photo studio to take cosmetic pictures. We work with a company called Amity Technologies, which you guys have heard about. Absolutely phenomenal. They understand your needs. They put intraoral cameras, TVs on the ceilings. They helped us with the photography. So it's nice to have the support of a company that has a dentist involved. So he really knows what you need and want. So finishes on the clinic. This is like cool. You get to like really fancy it up. So we put some stone walls in. We put some fireplaces. We put some of our values on the wall. You can really make it look cool for very inexpensive, and patients just get wowed when they walk through the doors. So that's kind of like how you build the clinic, and that's actually probably the easy part. The next few steps that I got to talk to you about is how we actually implement the clinic once we've actually been made. So this can be so overwhelming. You have scalers, you know, cavitrons, restorative equipment, endo equipment, oral surgery equipment. It can be overwhelming if you're putting something together by scratch. Practice development. So we've already, I think Jake talked about it a little bit. So, you know, coming up with a business plan and a financial plan so that you can repay those loans. You know, there's nothing worse than spending $1 million on a startup clinic, hiring 3 staff, then all your other overhead expenses, and then realizing you have about $40,000 of payments that come out of your bank account every month, and you have 0 patients in your door. So you need to plan for that. Brand development and marketing. So I like to break that down into internal and external. So internal marketing is the cheapest form of advertising you can possibly get. Are you asking your patients for Google reviews? Are you asking your patients to refer their family and friends to you? These are no-cost solutions, and they will absolutely grow your practice. Externally, are you using those forms of advertising, but are you tracking it? So there's Google AdWords, Facebook, mailouts. You know, determine what a patient is actually worth to you. If you're a conservative dentist, it might only be worth $200 to $300 per patient. If you're a high-end dentist, it might be $1,000. So if you're going to run a campaign on Facebook and you're going to spend $5,000, see how many people are coming through those doors that were referred by Facebook, and then multiply that by what the patient's worth and see if it's worth your while. So you need to do that for every single track of marketing, because no one can tell you what works and what doesn't work. From having clinics all over across southwestern Ontario, I can tell you every single demographic is different. Every single city is different. Sometimes Facebook works, sometimes it doesn't. Sometimes mailouts work, sometimes they don't. So you need to be tracking all that. Operating efficiency. We hear all the time from our managing partners, oh, my assistant didn't do that right. My front desk didn't do that right. How is it that if you go to McDonald's in London, Ontario, and you go to McDonald's in Shanghai, you can get the exact same Big Mac, and it's made by a 15-year-old kid that makes minimum wage? Well, the reason is because they have systems and protocols. So you need to put this in place in your dental practice. If you don't put that in place, you're the only person to blame. So it's not your front desk, it's not your assistant, it's you for not putting those systems and those checkpoints in place. And communication platforms, don't be the bottleneck. Have people, you know, the small decisions in the practice don't need to be all decided upon yourself. Have a system in place that they can go to other people other than just yourself, the dentist, to solve some of the small problems that come up. Human resources and compliance, this is associate agreements, training, OSHA, WMIS, first aid, emergency manuals, safety manuals, RCSO guidelines, compliance. This is why the DSOs and the big companies like Dr. Shivji is going to talk about next, corporate dentistry, because running a day-to-day practice and running all this stuff can be a full-time job in itself. So companies like that will take all the burden off of you and let you be a dentist. So there's a ton of things to follow with respect to a compliance standpoint. Management and leadership, Dr. Shergan did an absolutely great job this morning talking about management and leadership. In my opinion, there's 4 ways to summarize management and leadership to be successful in a dental practice. If you have a good culture with your team, that's number 1. Make sure everyone gets along, make sure everyone's having fun at work every day. If you have good systems in place, so making sure everything's flowing smoothly. Overhead and cash flow, that's the 3rd one. And then being run by an effective leader who keeps honesty and integrity at the number 1 position. If you have those 4 factors, you will be successful in the dental practice. And then lastly, we have practice metrics. So the football games this weekend. There's tons of football games. How exciting would the football games be if there was no scoreboard? You know, the football players wouldn't actually care. They wouldn't do anything. And the fans wouldn't be cheering because there would be no scoreboard. No one would care. Running a dental practice without tracking your metrics is like running a football game without having a scoreboard. How are you supposed to motivate your team? How's your team going to work harder and do better for you if you're not telling them how they're doing? So tracking everything in the office, from downtime to retention rates to productivity to case acceptance to overhead control to the number of active patients, this is like your scoreboard. And having these numbers presented to the staff on a daily basis or weekly basis is super important. It's going to motivate them to do better. Key performance indicators too. So with all the multiple locations, we're tracking every single dollar that's going through the company on a monthly basis. So tracking all your variable expenses, your lab, your payroll, your rent, supplies, advertising. These are all things that need to be tracked daily on a startup location or just your normal daily practice. So, and then lastly, what Melissa just talked about, communication. So communicating with your team, communicating with your colleagues, having somebody to talk to, I think has been a big theme for today. And I love this quote: your success in life is directly proportional to the number of uncomfortable conversations you're willing to have. So being able to communicate with just about everybody will increase your success. So I think I summarized it in about 20 minutes or 30 minutes, so that's all I got. Thank you, everyone.
So it's interesting with Mike as well, unknown statistic with all his offices. I think Mike's up to about 40,000 patients right now that he looks after between the various brands and groups and so forth. And what's unreal with Mike is if you text Mike almost any time during the day, in spite of everything he's got going on, you'll typically get a response from him within about 5 minutes. It's unbelievable how connected and plugged in he is to all of his relationships, his patients, and certainly to everything he does. So Mike, thank you so much again for sharing this cool thing that you're doing. It's disruption because so many of us here in the room have had this conversation: how do I do my first startup? And we sometimes paralyze ourselves into this thought of, I have to overanalyze it, I got to do this. And you can sometimes spend 5 years, 10 years just with the thought about it. But once you take that leap, you start getting a little bit strategic with it. You can do 1, 2, 5, 10, 20. There's no limit to how you can do it. So that's disruption, man, big time.